Blame for the crisis in A&E. Figures from the Royal College of Emergency Medicine suggest there were more than 16,500 deaths. What? Let me see that figure again. That can't be right. 16,500 deaths in England last year as a result of long waits for hospital beds. And we know, don't we, that they now advertise for corridor nurses. That's now a profession in this country. The numbers have increased by 20% on the previous year. This works out at 320 deaths a week in England. One doctor said it's the equivalent of 2 aeroplanes crashing each week. This is just A&E related. He said it's the result of a system in crisis. Who's to blame? Did the Tories ruin the NHS? Or is it a failing of the current government? Maybe it's a wider problem. Paulette, you mentioned you're a former nurse, so tell us.
Well, let me just tell a story. Lord Darcy came in 9 weeks after we came to power last year, and he did a report, and he talked about the state of the NHS. 3 things I'd like to comment on. We were 20% short on health visitors. We were lacking nurses, doctors, GPs. We couldn't get appointment. Buildings were crumbling. The finances of the NHS was in disarray. It wasn't that the Conservatives hadn't put money into the service, but 14 years of mismanagement has led to a lot of problems. And what Labour did, what we did, and I don't like to just harp on, we put £26 billion into the NHS.
I didn't think it was money it needed. I thought that was the point that you said.
No, because
it's got the money.
I believe, Jeremy, that you've got to invest if you're going to save, because you can't just say, I'm not going to put any further money in when the thing is crumbling.
Yeah, I don't know.
The money will come back out.
Often the money gets taken by the staff, and I'm not complaining about that.
But I don't think that's happened this time. I think what Wes has absolutely tried to do is look at the areas where we're really struggling to develop them. But going on to the point, it has been a lot of years of mismanagement, and it will take time to recover. But I have to say how sorry I was when I read the stories about the people that were dying.
So, yeah, 320 patients a week may have died needlessly in England just because when you arrive at A&E, you don't get seen. And that, you know, there's no getting around that, Tim. And it looks, from what Paulette says, you've got to say it's the last government.
Well, a friend of mine recently, I've had good experiences. I've been to A&E 3 times in the last 5 years. I've been treated very well. But a friend of mine recently went with some heart problems. And he counted 7 times that he met different people along the way before he was treated, all asking him the same questions. And he said to them, are you asking me the same questions to check that my brain is functioning or something? And it was just like, no, it wasn't a test. It was, there's something wrong with how we organise the National Health Service. And I think the Tories messed up with the Lansley reforms, this big reorganisation.
No one understood them.
No one understood them.
Even he didn't understand
No one understood them. And they've now been, you know, basically, West Streeting's done the right thing in trying to dismantle them. But it's another reorganisation. Is it going to work?
But what if you just did a thing? Because this seems to be what a lot of viewers say. Let's say you've got hospitals in Birmingham. I don't know how many you've got, half a dozen?
No, we've got 3.
3, OK. Well, wasn't that far off. So you just take the money for the 3 hospitals and you give them to the hospitals and say, that's it, do your thing. We're not going to measure you. We're not going to get you competing. Just do your thing. Would it go wrong? You don't have ministers in charge of it. They just simply put it in the front line and they get good medics to treat patients, and that's it.
I don't agree with
Wouldn't work. You think it won't work?
Well, I think measurement is really important, because what we do know, because we measure, is certain hospitals perform an awful lot better with the same budget than other hospitals. What we need to do is more understanding of why those hospitals perform better. So, actually, I'm certainly against less measurement.
But I mean, look, if I am dying one day, I'm going to want a really inefficient nurse. I'm going to want you by my bedside, and because you want to talk to me, you're not seeing any other patients. Now, fundamentally, caring and efficiency are opposites, aren't they?
No. They're not.
Of course they are. I want the worst nurse on the ward. I want the one who says, look, I'm looking after Jeremy. You can sort the others out.
You're talking about a hospice care.
No, I'm not.
Hospitals are different about...
I don't agree with you.
I don't want you rushing from one bed to another.
No, but at the end of the day... I know.
You're a naughty
Sorry,
boy.
I've got a dirty mind this morning. But anyway, right, I don't agree with you. I think we can work far more efficiently in wards. You don't have to be at somebody's bedside 24 hours a day as a nurse to not work efficiently. The problem is a lot of money was spent in places that it shouldn't have been spent. And what the government has been trying to do is dismantle some of those areas where money was being wasted. So we can move from analogue to digital. So we can move back to community, so to prevention type care, because where the money was placed was not where people really needed the care at this moment in time.
So this is sort of focused on A&E, but A&E is like the canary in the coal mine with the NHS, isn't it? You see a lot of what's going on in the NHS through A&E because it's where a lot of us engage with it for the first time. So the figures are bad. Barbara in London, whose fault is this?
I think originally the fault was Tony Blair, who renegotiated the doctors' contract, meaning they didn't have to do out-of-hours calls. So that started to clog up A&E way back then.
Yeah.
Following that, a complete failure of Labour and Tory to sort out the social care crisis, complete mismanagement of the NHS, too much bureaucracy, too many managers, so the money wasn't going into the right thing. Procurement is a big thing with the NHS. You know, they buy in bulk, yet pay far more for, say, paracetamol. You know, then you can get three packets for £1 in Poundland, but they pay about 3 times as much as that, and yet they're buying in bulk. So
that's amazing.
So I think these are the main reasons. That none of the government seem to be willing to really reform them.
We have Barbara's health secretary. She really seems to know what she's talking about.
Well, yeah, but what would you do, Barbara? Because you've also got to get the staff, if you're going to reorganise it, the staff have got to be willing. And they've had so many reorganisations, they just feel like they've just been bashed about the head with them.
I think they need business people in there. You know, people. You know, it's almost like remember the old-time emotion studies that we used to have years ago. Yeah. People to go into every hospital, and I think, as Tim said, you know, that some hospitals do far better. So what are they doing? We need people going in and saying and finding out what they're doing right and transferring it to the hospitals that are failing.
Thank you, Barbara. Interesting. Joanne in Lancashire, hi.
Oh, good morning, everyone.
Hiya.
Paulette, I disagree with you totally. I'm finding that every time you're on, you are just for Labour regardless.
Well, she's the Labour MP, Joanne. Sorry, I mean, she...
Yes, I know.
It's kind of her job, Joanne. Come on.
But she seems to be blinkered. Tim, yes, I do partly agree with you, but your last call at 100%. Now, I was taken into A&E last Friday, so 6 days ago, with severe stomach pains. It turns out I had water on my lungs.
Water on the lungs?
I don't know. Yeah, I know.
That, and what's caused that then? Infection?
Well, I don't know how that happened, but regardless of that, I went to Oldham Hospital. The staff were wonderful, the nursing staff, but they rushed off their feet. They didn't have time. I was put in. We weren't put in A&E as such. We were sent onto a ward, but it's a triage ward, so it's just smoke and mirrors. A&E, they're making it look as though A&E is working now at the Labour government, as far as I can see, when in actual fact, they're shoving us to different parts of the hospital where we're still waiting for hours and hours. I was there from 5:30 in the morning. I didn't get home till 7 o'clock at night. Well, actually, I think it was later than
But are
that.
you okay now?
No, I'm not okay, but I've got other underlying issues. But what I'm saying is, the transferring the problem from A&E and people aren't seeing it. I wouldn't have known that last week if I hadn't have actually been in that situation.
Well,
so A&E is still as bad.
Thank you for telling us about it, and all the best getting well. Have we got time for one more call? Amanda in County Durham, hi.
Hi, morning everyone.
We're trying to work out whose fault it is because something's going wrong here.
I think it's a bit of everyone to blame. I don't think it's just the government, and I don't think it's just the GPs. I think it's a bit of both. See, with GPs now, my husband's got epilepsy. He works from like 9 to 5 every day. He's got weekends off. He hasn't been able to get a doctor's for about 7 months. And I just think it's ridiculous.
Well, this is because we're talking here about GPs. OK, this is a big thing. For some reason, so many GPs just do office hours and not weekends. And what we know has happened to A&E is it's been swamped by people who can't see their GPs. So did your husband do that as well?
Yeah.
Right.
He tries not to. Because
no, I understand.
He sees people that are in A&E and going, well, I'm not going to go there unless I'm really bad, and then I have to go there.
Yeah, I understand. This goes back to Blair as well. I mean, it's been a while this has been the case, hasn't it, that there's patients dislodged from GPs ending up at A&E.
But also, what you've got to look at, I know what the lady before said,
Don't worry about
what
that.
you have to look at is what Labour are trying to do. What the government has done, they have increased the numbers of appointments you can get through a GP, but what they've been doing in the background is actually looking at the GP contracts to see how they can make them far better than they were when we came back into power after being out of power for 14 years.
Yeah.
I think the problem with what Labour are doing is you said you wouldn't put more money in until you'd reformed it, and you've done exactly the opposite. Now, you could be using the money to make reforms to, like, the doctor's contract, and I think it's been done the wrong way around.
All right, one more call. Robert in Bradford, hi.
Hello.
Hello, what do you think? Is it possible to blame somebody or say this is where it all went wrong?
No, I was in A&E about 2 weeks ago for 14 hours, and I got told at the end of it, oh, go home and get some sleep. That's all I got told.
What was wrong with you, Robert?
I'd got uncontrollable shakes.
Uncontrollable shakes.
And it was for no reason. And all they told me in the hospital was go home and get some sleep. That was it.
And did you get better?
14 hours.
Did you get better?
No.
No. You still got them?
No. If I would have not been in A&E and I would have been at home, it'd have been the same thing.
Yeah, Robert, there we are. That's not good. Thank you. Best wishes to anyone with that condition. Find out why Putin and Trump are swerving the peace talks.